Hi, in this video I'm going to be talking about tobacco cessation or quitting smoking. And although we don't have as much data about vaping, a lot of the same things in cigarettes are also in vaping products. So I think on the safe side, this video applies to vaping as well as cigarette smoking. So why are we talking about quitting smoking when you're going through a very stressful time in your life? And shouldn't we just let you do what makes you feel better and not add one more thing when you're going through breast cancer treatment? Before I proceed, I'd love to invite you to subscribe to our channel, and you can go to yerbba.com to learn more about what treatments might be offered in your case. So back to tobacco cessation. First of all, we know that tobacco smoking is not good for any of us. But what are the specifics related to breast cancer, which is not known to be caused by cigarettes, with the exception of people who smoke when they're very young, when the breast tissue is developing, like 11 or 12. So why would you want to quit smoking or using vaping products? There are several reasons. One is that smoking increases your risk of complications, particularly from surgery. It delays wound healing. There are, in fact, some surgeons who will not do reconstructive surgery if you're smoking, because smoking increases the risk of what is called flap failure, where the flap of skin, if you have autologous reconstruction, you can check out our reconstruction video where we use tissue from the belly or your backside or your back itself. That is tissue that's trying to graft to the area where your breast was. And smoking increases the risk that that flap will fail or have to be removed, that it doesn't take. And that can be really upsetting for people, as you can imagine, going through a major surgery and then having to have that flap, what we call, taken down. Even if you're just having a lumpectomy and lymph node removal, and I don't mean just as in this is nothing, but it's certainly a much simpler surgery, smoking can increase the time it takes for your wound to heal and the time it takes for you to get on to the next part of your treatment. Smoking also increases the risk of blood clots, which is already increased in people on chemotherapy. So chemotherapy will increase your risk of blood clots a small amount. But if you're smoking and on chemotherapy, the risk of blood clots goes way up. So these two together cause blood clots. Add them together, it's even more than the sum of the parts. It's sort of a synergistic effect. And that's the last thing you need when you're going through chemotherapy. And some of these blood clots can be very serious. So as a medical oncologist, I always encourage my patients and help them quit smoking. During endocrine therapy, there are some endocrine therapies, specifically tamoxifen, which is a selective estrogen receptor modulator. You can watch our video about endocrine therapy if you want to. These also, because they look like estrogen, they're like a weaker estrogen, they actually increase the risk of blood clots. And when you smoke along with these medications, it increases your risk. There are a couple other reasons. Side effects are worse if you're smoking. We're not exactly sure why, but we know that people have more nausea, more fatigue. It's probably because your body is fighting the foreign substances in smoking, in cigarette products, as well as everything else we're asking your body to go through. But we know tolerance of therapy is much lower in people who smoke. I am not trying to scare you. I am trying to motivate you. So how do you go about quitting smoking? First of all, I want to acknowledge you're going through a difficult time, and now I'm asking you to do something that's even harder. Quitting smoking is one of the hardest things to do, and people who don't smoke are so happy they haven't started, because quitting is difficult. That's the first thing I want to acknowledge, is that this is a hard time in your life and that quitting smoking is really hard. On the other hand, you may want to use this as an opportunity to take the absolute best care of yourself. It's possible that this is the exact motivation you need to help you get over the hump and the barriers to quitting smoking. So you might want to look at it that way. I don't want to tell you how to feel or how to think about this. This is your own journey, but I have learned this from my patients that they use this. If you are watching this and you are not going through breast cancer and its treatment, but you're supporting somebody who is and you smoke, this is one thing you can do to help, because if they try to quit and you're still smoking, that makes it really tricky. So I'm going to talk first about sort of things your medical team can help with. First of all, we can refer you to a tobacco quit line. You can refer yourself to a tobacco quit line. These quit lines have people who are trained in something called motivational interviewing. They don't just get on the phone and say, how can you keep smoking? You should quit. How stupid are you? No, what they do is they tap into your values. What's important to you? And they help you use those values and strengths you already have to help you quit. There's no shame. Your medical team may use shame to help you quit. We don't always know the best ways to help people, but I can tell you this, shame is not one of the ways that helps people change their behavior for the better ever. So you want to find out, when you call a quit line, what's their method? Do they use motivational interviewing, which is a form of behavior change counseling, or are they just giving you information on all the risks of smoking? Frankly, you already know those, and you still have had a hard time quitting. Most people who successfully quit smoking quit 7 times before they are successful. It's never too late to try, and this time might be the time it takes. There are other things that your insurance, if you have insurance, are very likely to cover, whether it's nicotine gum or nicotine patches. The nicotine patches appear to work very, very well. These are prescribed, and your doctor can prescribe them for you. Even though they have nicotine in them, they don't increase the risk of blood clots to the same extent as smoking. Smoking introduces a lot of products that irritate the blood vessels, and that's what sets up the blood clots and other problems we see. All that stuff cruising around in your veins is from the cigarettes themselves, or the vaping itself, are much more dangerous than a nicotine replacement patch. The patches work really well. There are other things that can reduce cravings, and there are other things you can try. I'm going to mention a few of those. Figure out why it is you smoke. Is it that you like to do something with your hands? Is it a ritual? Do you need to have something in your mouth? So depending on what sort of thing you're looking for with smoking, if you can try to pinpoint that, that will determine what you can do to replace that, in addition to actually prescribed medications. So if you need to have something in your mouth, you can try gum, not even nicotine gum, just regular gum. You can drink through a straw. That can give you that same sensation. Some of my patients have used toothpicks. It's just something in their mouth. If it's something to do with your hands, you can get a fidget, like those little spin fidgets we used to have a few years ago that everybody was selling in drugstores and gas stations. You can get multiple different kinds of things. You can knead one of those kneading balls, so that kind of thing can help too. If you're bored, you'll want to, and that's why you smoke, and it's part of your routine, you may want to consider switching up your routine. So a lot of people will smoke after dinner, or they'll smoke with their coffee in the morning or their tea, and you might just want to shake that up. So let's say you are used to sitting in your dining room, you have breakfast, and then you have your first cigarette. Change where you have breakfast. Just changing the setting can really help. Same thing after dinner, instead of lighting up a cigarette, you can go for a walk. What you want to do is sort of jar your body and your brain into thinking of new things and changing the setting that you're in. You can go to places where smoking isn't permitted. Most places now don't allow smoking, but try to stay away from places that do. You may want to. One thing that really works is some aversion therapy. So some people will take their ashtray and mix a slurry of all the ashes and have that around, and the smell will be so aversive they actually can be disgusted by cigarettes. So figure out what will work for you. There are a lot of resources that help. You do not have to do this alone. Talk with your medical team. If your oncologist doesn't seem to have ideas, talk to your primary care doctor. Primary care doctors are trained in helping people to quit smoking. Don't forget to subscribe. Like this if it's helpful for you. What that does is help other people who are really similar to you find this video. Drop a comment below. Tell the Yerbba community what's worked for you. How did you quit smoking? Or ask for more advice. I respond within a week to 2, and other people in the community will respond to you too. So, you don't have to do it alone. Thanks so much for watching.